Good afternoon. Thank you for tuning in to the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macy Smith. The show today is sponsored by MUSC Health Orangeburg. Joining me today from MUSC Health Orangeburg is Melissa Summers. Melissa is the Quality Management Data Specialist for the hospital. Welcome to the show today, Melissa.
Thank you for having me.
So I have to ask you this. What exactly is a Quality Management Data Specialist, and what do you do for the hospital?
Okay. Part of my role is to evaluate complications. It could be a surgical complication, pressure injury, any type of adverse event that can occur in the hospital. And we do work to try to do preventive measures, implement new products or procedures or policies that might help prevent future problems from occurring. Also, making sure we stay in compliance with CMS.
That's important.
Yes,
You don't want to get those tags.
Yes, so there are certain measures we have to follow with that. Part of it is the maternity measure that we'll talk about in just a little bit. And also there are surgical measures that fall into that, as well as making sure you have VTE prophylaxis when you're in the hospital, making sure you don't develop like a pulmonary embolism or a clot, otherwise known as a blood clot.
A blood clot.
Yes.
So when you talk about those preventive measures to reduce the risk of occurrences or situations or problems, is that on the clinical side, or is that on the patient side, or is it both?
It's normally a combination.
Okay.
Because if a patient comes in and needs what we call DVT prophylaxis, making sure they're either on heparin or making sure that they have the, what some people call the little airplane booties, making sure you have your SCD or TED hose on, those kind of things.
Oh, yeah.
Yes.
Now, what is your background? Because you got a big old job here.
Yes. I have worked as a nurse for 31 years. 28 of those have been within these walls.
Oh, you've been here at MUSC Health Orangeburg for 28 years.
Yes. So I have done a variety of different things. Worked as a med-surg nurse, labor and delivery, diabetes education, and I've been in quality for a number of years.
Oh, wow. And I don't think a lot of people even know that MUSC Health Orangeburg has a quality management department, because when you're dealing with people in general, especially, healthcare, you want to have a quality measure. How important do you think your role here is at the hospital?
It is very important, but I will say quality cannot be just with one or two people in a department. It takes a village.
Yes.
Everybody in the hospital, as I say in orientation, it's everybody's part. If you see something that needs to be addressed, we need to fix that in real time.
I love that. And that actually really speaks to the new designation that MUSC Health Orangeburg recently received. We're going to take a break. When we come back, we're going to talk about that designation and what it means for the community, the Tri-County area here in Orangeburg. We'll be right back. It's the People Station. Welcome back. You're tuning into the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. We're still chatting with Melissa Summers. She is the Quality Management Data Specialist. Now, Melissa, MUSC Health Orangeburg recently received a designation, an award. Can you tell us about that?
Yes. This award was awarded by Blue Cross Blue Shield. It's for the Blue Cross Blue Shield Blue Distinction Center for Maternity Care Plus Award. And this award is granted to hospitals that are following nationally recognized measures and goals,
quality measures,
and also for cost effectiveness.
Wow. That's exciting for me. I tell folks all the time, I'm from here. I'm from North South Carolina, and we did speak with the CEO just about the perception of the hospital in general, and how people did not have a good view of the hospital. But we talked about the things that were changing, the supports and the areas that have been improved upon, not only with staffing, but with quality measures, as you're talking about. And this award, to me, elevates just what he's saying in terms of changing for the better. Do you see it that way as well?
Yes, I do.
Yeah. In terms of quality, right? You have this designation, you have this award that means MUSC Health Orangeburg has met or exceeded the indicators that are outlined for the hospital to follow. But we know that there's still going to be situations and incidents that may occur. In the event you come across a concern, what does your process look like?
Okay. For this program, it requires continuous quality improvements. So every month or as a situation might occur, we are on it reviewing those cases. Part of this award is having standardized protocols and procedures for certain events that could occur. We would like for them not to.
Yes.
But with maternity, you're at high risk for postpartum hemorrhage. So there are protocols in place to ensure that first of all, the nurse recognizes it. Second, that she elicits a quick response and also elevates that care if so needed. So there are different steps to the protocol that the nurses are excellent at following. And also, after an event occurs, a debrief occurs, whether, the patient, all of our patients do well, but it's always a good idea to review what occurred to see how we can prevent further events.
Now, are the patients ever involved in any of that conversation or debriefing?
Yes, they are, because they're integral to the process.
Oh, absolutely. I agree with you 100%. And what you're saying really is music to my ears when we think about the maternal mortality rate. And so, you guys are doing a good job here. We're going to take a break. When we come back, you mentioned preventative measures earlier. I'm wondering if you can tell our listeners and our viewers some of the preventative measures or things that they can do when they have to come to the hospital. Okay. We'll be right back. It's the People Station. Thank you for sticking out with us for the Health and Wellness Hour. We're still chatting with Melissa Summers. She is the Quality Management Data Specialist at MUSC Health Orangeburg. Melissa, before we went to break, I wanted you to talk about some tips or some strategies that folks can, put into play when they come into the hospital. But before we get into that, I want you to tell our listeners and our viewers about some of the additional awards that MUSC Health Orangeburg has received this year.
Okay. The hospital received the South Carolina Hospital Association Zero Harm Awards, and this program encourages a high reliability culture using evidence-based practices to prevent adverse effects from occurring. We received 4 awards. One was the Zero Harm for Workplace Violence, and that is ensuring that the hospital partners with Anthem Risk and works to make sure our policies and procedures are protecting the safety of not only our patients, but also our employees. Okay. And also we offer counseling for employees if they've ever had an adverse event that feel like they need counseling for. So
that makes sense.
Yes.
Now, with your awards and your designations, to me, that's already elevating the hospital from where you were last year, because you've got new awards from last year, and it positively impacts not only hospital staff, personnel, and patients, but also the community. What do these designations and awards mean to you as the quality management data specialist?
Well, we also received another award for Zero Harm for behavioral health, which is Zero Harm for suicide. Oh, wow. So for our behavioral health unit, Teresa No has been instrumental in making sure that we have kept, this is a certification we have had. Okay. So we have kept this, and it's just ensuring that risk assessments are done, that all the staff are trained in suicide prevention and training, escalation management. Also making sure they have a safety discharge plan on discharge.
Always important, yeah.
And also that coordination of care for the next level provider. Yes. And we call that a warm handoff. Just ensuring that that patient has immediate follow-up, because if you have any type of psychiatric history, it's very important for you to have follow-up.
Yeah. And I'm very big on self-advocacy, being self-sufficient. Some people are scared to come to the hospital. Some people come to the hospital a lot. You got different variations. But for those who are coming to the hospital who need surgery or need treatment, what are some advice you can give to them in order for them to advocate on behalf of themselves?
Right. Well, one thing with one of our
and reduce their risk of other conditions?
One thing for our patients that are having elective total knee replacements, this is one we also received a Zero Harm Award for, and it's just making sure that you do the proper things you need to before you come to the hospital, like doing CHG, bathing. Everybody seems to think it's crazy that you have to take a bath with a certain type of soap, but it's very important to do that. And also making sure your diabetes management is under control, making sure your A1C is at a good level so that you can promote healing preoperatively and postoperatively.
Well, thank you so much. It was a pleasure chatting with you, Melissa. The Quality Management Data Specialist. MUSC Health Orangeburg does have a quality management division that's doing exceptionally well, as evidenced by the awards and the designation. So thank you for your 31 years of being in the nursing field and your 28 years from being here at MUSC Health Orangeburg. It is definitely showing. Thank you so much for being here.
Let me tell you one other award.
Okay.
Zero Harm for CLABSI, which CLABSI are central line infections, and central lines are put in when patients are critically ill, especially for ICU patients. So trying to reduce the risk of developing infections
like
is
sepsis.
extremely,
MRSA.
If you're treated for sepsis, possibly you might have a central line. So we work really hard to make sure that patients do not get infections from those central lines.
And let me make sure I heard that correctly. Yeah. You all received Zero Harm Award for
CLABSI, for one of our nursing units, medical surgical step-down unit, otherwise known as MSSU to the community.
Melissa, that is very exceptional. Thank you for sharing all the great things that MUSC Health Orangeburg is doing, and under your direction as the Quality Management Data Specialist. Thank you so much for being here and for sharing with our community.
Well, thank you for having me.
Thank you all so much for sticking it out with us and being here for the Health and Wellness Hour. The show today is sponsored by MUSC Health Orangeburg. Until next time, it's the People Station.